Hi, my name is Dirk, and I'm the Deputy Director of Medical Innovation and Care Transformation at the KK Women's and Children's Hospital. That's a large hospital in Singapore. So my role and our role as MICT is basically to stimulate innovation both in the Women's Tower and the Children's Tower by linking up all the potential stakeholders that are necessary to renew and to improve. So all the way from entrepreneurs to academia to large companies to getting the funding there, to work with government, to not work within hospital environments only, but also with primary care and with nursing homes. So it really includes actually everything that is necessary for innovation. And our role is basically to facilitate, so to connect the right parties and to basically make sure that 1 and 1 is more than 2.
And so in terms of the result of those collaborations for the patients, what is it that you're hoping to achieve?
Yeah, so the goal is really improvement in patient care. So we are an academic medical center, so we do have academic interest as in research outcomes, but the ultimate goal is to improve patient lives. And the results really should be very practical, affecting patients directly in their outcomes. So just to give an example of something that we are currently busy with, is trying to replace our face-to-face consultations into remote consultations. And even in a small place like Singapore, which basically is only one island, we do think and see that there's a lot of potential of replacing that visit to the doctor by a visit that you can do from wherever you are. So to give an example where currently it's working out quite nicely and useful for patients is pediatric eczema. So the number of children with eczema is growing all over Asia, and we do see that an increasing number needs to come to the doctor quite frequently. So the first visit that they have is still done in the hospital, but the follow-up visits can basically be done on a remote basis. Because of course you only need to show your skin to the doctor, and the pharmacist can actually determine whether you should have follow-up cream or not. So even in the constrained spaces of Singapore, our patients tell us that saves them on average 129 minutes per visit, right? Traveling time. And if you just do the calculations in terms of the lost income and the waiting time, that of course multiplies easily into the millions. So this is just one example of a project, but a lot of the innovations are related to technology and to the use of technology and to really make it happen. So again, with this video consultation, technology itself is not new, right? We are all FaceTiming and Skyping for a long time, but what is new is trying to change the business case for healthcare. And that includes a lot more, like, are patients willing to take up? Does it work, right? And does the business case work?
And so of some of those things that you just mentioned, which do you think is the biggest challenge that's facing being able to achieve those collaborations?
I think one of the big changes really is that we are changing the model of care from healthcare to health. And traditionally we are a hospital, right? We are KK Women's and Children's Hospital. But if we want to deliver health for our women and children, we cannot do that by just being a hospital. We feel that we need to be included all over the chain, wherever our women and children in Singapore, for our case, need care. We need to be around. So that means we cannot constrain ourselves to being anything like a tertiary place. We need to be around where they are there when it's prevention. Traditionally, the prevention role is done outside, right? We are not paid by keeping people healthy. We are paid by doing something for people when they need us, right? But our role is changing. And that's a challenge, because that includes a lot of different stakeholders that are traditionally outside hospital. That includes different budgets that are traditionally maybe outside of the budget of the Ministry of Health, but includes education, schools, right? If you talk about pediatric care, when it comes to prevention, a lot is done at schools. Currently, a lot of the budgets are managed differently by different departments. So a lot needs to be done to kind of bring that together. And I think that is definitely one of the biggest changes, not just in Singapore, but all over ASEAN and all over Asia. And actually, globally, you see the same trends.
I'm sure that technology will play a big part in moving some of those achievements forwards. So what would be your technology of choice at the moment to improve your hospital and academic efforts?
So just talking about the hospital itself in terms of our operations, I think we can make better use of simple technology that gives real-time feedback on how we act. Just to give a practical example. Hand hygiene, right? We've been talking about it for many years. I think for 200 years since Semmelweis. We know that we need to wash our hands, but we don't do it, right? Globally, the compliance 60%. Why are we not doing it? I feel it's too easy to blame people and to say that you don't know that your hands are unclean, so we need to show you that they are unclean, right? You know, we show them under that machine and they will show you, well, they look clean, but actually they are not. It's not a knowledge problem. Every individual healthcare worker all over the world knows that we need to wash our hands. The fact is, at the moment when we are supposed to do it, it's too easy to forget or to not do it or to have other priorities. And I think we are weak human beings. We should not, we probably are not able to just do it by will. We should force ourselves by systems, and I think that's where technology also can come in, to simply make it impossible to do the wrong. So if you want me to wash my hands before I touch you, right? You should physically make it impossible for me to step forward, no? To approach you, or to come out of this television and touch you, right? There should be a physical barrier, I believe. And I think we are still fairly early on in this development. So there are some technologies around that tag people, no, with RFID. Huge potential, but also a lot of vulnerabilities. Because if it's still dependent on whether I wear the tag on, no, it's still human behavior. We are currently doing a pilot with making an outpatient room where those conditions are already built in the room. So every patient and doctor using that room knows that hand hygiene performance will be detected by an infrared line. And at the moment when you're supposed to wash, if you didn't use the hand rub before, and there are sensors in the hand rub and sensors in the, in the chair, so the system kind of knows when you did not perform and then gives an auto reminder, a friendly bell that says, please now wash your hands at the moment when you're supposed to do it, right? Because I think traditionally when we just put a poster on the wall and say, wash your hands, it actually is nonsense, right? Because that poster is there all the time, and you're not supposed to wash your hands all the time. You want that reminder just at the moment where you're supposed to wash. And technology, of course, and sensor technology and the Internet of Things can play a huge and a very interesting role there. Of course, there's also a downside, right? That over-alarming, alarm fatigue. You know, is it sensitive enough? Is it specific enough? All the traditional things that are relevant for academic clinical research are in a sense also relevant for this kind of health management research. Right? So those are the topics that we are currently looking at, and I think they have great potential for the future of health in Asia.
So you've clearly got a number of projects ongoing at the moment in your hospital. What was your objective for coming to HMA 2017?
So I think the organization invited me to speak about some of these things in a session tomorrow, so that's probably the first objective to come. To be honest, I had heard about the HMA a lot because of the awards. I guess all over Asia we know that these are very important awards and really considered to be very effective in terms of predicting the results of the projects for potential future impact. At least that's what I saw in my environment in Singapore. It's my first time at HMA this year, and I'm very glad to be here. I think it is very unique to exchange from a healthcare administration perspective. Right? So when you look clinically, there's a lot of exchange of practices between individual clinicians on how exactly to do that surgery. Right? In eye surgery, if you look to the definition of how small could the incision be before you do a good surgery, that knowledge is shared easily between clinicians all over the world. But for health administration, we don't do that a lot. So I'm very glad that HMA has taken up this role, I believe, for 16 years already, and is bringing healthcare administrators together. With my academic heart, I do believe that healthcare administration also should be evidence-based. So instead of just shouting, we should really prove what the best answer is. So to reflect on the debate that we had earlier today, should a doctor or a non-doctor lead a healthcare institution? For me, the first question would be, what will the evidence show? So I'm very glad to see a lot of projects going on that are really gathering evidence in this meeting as well. And I think I learned a lot, and hopefully the session will be useful as well.
And so hopefully, you would join us again for HMA 2018. And if that was the case, what insights would you hope to be sharing from your hospital in 12 months' time?
So hopefully we have good results based on that hand hygiene project that I shared before. So showing a bit more impact of what data and big data is actually doing. Because I think currently there's a lot of wording going around on the potential of precision data and precision medicine. But a lot of the results still need to be shown. The same is true for remote vital signs monitoring. We are trialing a couple of those metrics, But in terms of the accuracy, I think there's still some work to be done. So hopefully in 12 months' time, we have more data on that, and we can present a little bit more evidence on how IoT really can help health systems to predict a better future.
Fantastic. And so final question, obviously HMA moves around different countries, and in particular for HMA 2017 we have a few sort of hospital site tours. If you could visit any hospital, either in Asia or the world, which hospital would it be and why?
I feel it's a very hard question to answer because it really depends on the objective of the visit. For me, there is not a lot of future for hospitals per se. So I would suggest HMA to change the name to health. Hospitals is just one part of that chain. So in the future, I think there's still a role for hospitals, but there's a role for specialized knowledge. But there's probably not a big role for hospitals as standalone units. There's future for health networks and all the participants that are necessary. And some of it, yes, need to be acute care, but a lot need to be prevention, primary care, and about that health chain. So I don't want to visit or to recommend any hospital. I think we should visit integrated health systems. There are a few famous examples around in the world. I think both in the US and in Europe and in Asia, there are fantastic examples of people who say, let's move away from just the hospital. Let's make sure that we show value all over the value chain. And that means that the hospital is the place that you don't want to go, right?
Fantastic answer. Thank you so much for your time.
Thank you very much.